Hello, folks. Good morning, good afternoon, or good evening, wherever you are. I'm your host and moderator, Shaili Prasad. I'm the director for the Center for Global Health and Social Responsibility here at the University of Minnesota. Our center has had this pleasure of co-sponsoring and hosting with the Human Rights Lab here at the University of Minnesota, a series of public-facing events, Envisioning the Future, Advancing Human Rights in a Time of Crisis. The goal of this series is to advance human rights in this challenging time by identifying the gaps in protection, opportunities for new forms of advocacy, and proposing legal and policy changes. If you're on Twitter, you can follow us at #EnvisioningFuture. That's one word, Envisioning Future. Our initial program, Revisiting the Right to Health, State Responsibility for the Highest Attainable Standard of Health in a Post-COVID World, took place on April 28th, and it featured Dr. Larry Gostin from the O'Neill Institute at Georgetown Law School, Dr. Ramaswamy Balasubramaniam, development scholar from India and visiting professor at Cornell University, Professor Fionnuala Ni Olain, Robina Chair in Law and at the University of Minnesota, and the United Nations Special Rapporteur on the promotion and protection of human rights and fundamental freedoms while countering terrorism. My colleague, Barbara Frey, who's the director of the Human Rights Program at the University of Minnesota, moderated that webinar. We are planning on another event later this summer on gender issues related to the pandemic. Please stay tuned for that. Today's program is Balancing Rights and Responsibilities During the Pandemic and Beyond. We will be recording this webinar and it will be available for viewing at our website. Today we have the distinct privilege of another wonderful panel. Professor Catherine Sicking is a Regents Professor Emerita at the University of Minnesota and the Ryan Family Professor of Human Rights Policy, the Harvard Kennedy School. Professor Ranit Mishori is a Senior Medical Advisor to Physicians for Human Rights and Professor of Family Medicine at Georgetown University. And Professor Joachim Savelsberg, Department of Sociology, and holder of the Arsham and Charlotte Ohanessian Chair, dedicated to issues of human rights and genocide at the University of Minnesota. For today's webinar, we want to tee up the discussion based on Dr. Sicking's latest book, The Hidden Face of Rights Towards a Politics of Responsibility. In this, she argues that we should consider the responsibility of all actors and not just states to take action together to guarantee human rights. This argument takes an urgent relevance in the era of the coronavirus pandemic, when we must rely on the preventive individual actions of all people to ensure the right to health is fulfilled. Welcome again. Dr. Sicking, why have the human rights obligations traditionally been framed as the responsibility of governments and state actors and not individuals? What responsibilities do individuals have to guarantee the right to health in this emergency? And how can those responsibilities be enforced? What are the human rights risks in this approach?
Well, those are great questions. I just want to begin by thanking the organizers and the sponsors of the event, and especially Barb Fry and the U of M Human Rights Program, and just say it's always a pleasure to be back on a panel with my U of M colleagues like Joachim, but also to meet new colleagues. And I was actually really curious about the Center for Global Health and Social Responsibility, because I see responsibility is already in the title of the organization. So perhaps you'll tell me that story later. So, you know, why have human rights, why have human rights questions been framed in terms of responsibilities? I'm gonna go into the very history that I studied to answer that question. I got into this topic when I was researching my previous book called Evidence for Hope, and I talked about Latin American protagonism for human rights, and because the first intergovernmental Declaration of Rights was the American Declaration of Rights and Duties of Man, passed by 20 Latin American states and the US in April 1948. In other words, 8 months before the Universal Declaration. But I didn't pay attention to the whole title of that, but it was Declaration of Rights and Duties of Man. And so then I came back to the duties question, and it turns out that declaration had 10 individual duties. Those duties did not get transferred into the Universal Declaration of Human Rights, which has just one article on duties. And I think they didn't, and this goes to the question that you began by asking me, because people felt that the question of duties was an old topic. It was sometimes a religious topic. And at that very moment where we were announcing the international protection of human rights for the first time, people feared that paying too much attention to duties might take the pressure off states to really take their duties and their legal responsibilities seriously to advance rights. And so there was a big debate about this, and continues to be a debate to this day. The notion of this notion I'm raising here about responsibilities is still controversial, and it's controversial because people still feel that states, we shouldn't take the burden off of states, and they fear that if we stress responsibilities of other actors, including individuals, that we might somehow be blaming the victims. Okay. Now, so the first thing I want to say when sort of how our responsibilities enforced, and it's partly they aren't enforced, and they're not enforced because unlike state responsibilities, they are not legal responsibilities. Okay, I'm talking, this whole book is about political and ethical responsibilities. And those political and ethical responsibilities are often partly discretionary. What that means is that we have multiple responsibilities we could act on. And so it's partly that people choose which responsibilities to act on and which not. And so they can't be enforced in the way that we might think of enforcing the duties of states. So in this book, I build on the work of a political theorist named Iris Marion Young. And she has a beautiful posthumous book called Responsibility for Justice. And in her book, excuse me, just was gonna pull something up here. In her book, she stresses that we need to have a social connection model of responsibility. And that is that all actors that are socially connected to a structural injustice and able to act need to act together in order to improve the situation. As Charlie said, this is extremely important for the situation that we're in right now in the coronavirus. I mean, I wrote this book, of course, before I had an inkling of the coronavirus, but it turns out it's quite a useful illustration of the basic argument, and that is that even if states were doing everything that they could do to, they were acting efficiently to carry out their duties, we still would not be able to address the crisis unless many, many other actors are taking action. And those actors, of course, include international organizations like the World Health Organization, but also state and municipal governments that have really stepped forward to address issues in the United States, for example, where the federal government has not been living up to its responsibilities in this area. But also we have responsibilities of healthcare institutions, and I think Ronnie may speak more about that. We have responsibilities of universities, as we've seen, to try to figure out how to balance rights and responsibilities, how to balance the right to education, in this case, with our responsibilities to try to keep people safe. And then we have these responsibilities of individuals. I mean, as we know, I mean, such simple things as if individuals do not wash their hands and do not stay at home, it's very difficult to flatten the curve of the virus. And so I think that that this issue helps us understand why to enjoy rights, sometimes to enjoy our rights, requires that many actors need to work together to take responsibility so that we can enjoy our rights. So I'm not sure, maybe I should see if those answered your questions adequately.
Thank you, Catherine. I think that was wonderful. I particularly like how you phrased it beyond the individual, also other entities. You know, what is the rights of universities, groups, maybe the public sector and the private sectors beyond just the state actors. So that's a beautiful framework.
And if I could just add one thing there, because I didn't mention something I've been working quite a lot on, and that's responsibility of transnational corporations at this time. And as we move towards a vaccine, and in particular, as we move towards whether or not that vaccine is going to be patented and how it's going to be shared with the world, there are big responsibilities here that universities will have, research institutions, but also corporations will have, I believe, to release these vaccinations free of patent.
Yes, thank you for that. Joachim, did you have a follow-up on that?
My entire comments are a follow-up to that.
Perfect. So why don't we go directly to you? One of the ways I want to frame your talk is about how does our experience from the past human rights crisis inform this current situation, particularly the balance between the individual and collective responsibilities, keeping in mind the social and political conditions related to this current crisis?
Thank you very much. I too want to thank the organizers for including me in this panel. It's wonderful to see Catherine Sicking again, who's moved far away, but who was one of the, maybe the founding actor in establishing human rights issues at the University of Minnesota. Now, a pandemic, like all catastrophes, allows us to see issues of human relations almost through a magnifying glass in a clarity that we normally do not see. We certainly recognize that rights are at risk during a pandemic: the right to life, the right to health, the right to assembly, to move about freely, but also economic rights, the right to work, the right to food, to livelihood. We also recognize that rights are interdependent, that civic and political rights depend on an adequate economic foundation. And we see that we need to balance rights. Rights can be in partial conflict with each other. We have policymakers face very difficult decisions nowadays between the right to health and the right to work, for example. It's not a zero-sum conflict, but it is a difficult balancing act. So I want to talk to individual responsibilities and rights, but also state responsibilities and rights. And I would like to make three theses or arguments. Number one, individuals must and they do take responsibility. Number two, states have a crucial role to play. And number three, states have to be kept in check, especially in situations of emergency. So number one, individuals must and do take responsibility. And I think they are obliged by law to do so, especially in welfare states. For example, the right to private property is accompanied by obligations. The German term is Sozialpflichtigkeit des Eigentums, social obligation associated with private property. But also in situations of emergency, accidents, for example, we are obliged to help others. In America, that's regulated by tort law. In other countries, by criminal law, in fact. We are not just obliged to help, to take responsibility, to seek the fulfillment of rights. We also do so because we are rational actors, at least in the sense of bounded rationality. We stay away from public places, not just because governors have issued shelter-in-place orders, but because we know that we are safer when we stay away from public places. We use food delivery if we can afford it to avoid grocery stores in order to not infect ourselves. So by guarding our own personal self-interests, we contribute to a public good, we contribute to public health. But of course, humans are not just rational actors, they're also moral actors. They live by a code of ethics. They take responsibility for others. And we see this today when parents teach their children, when schools can only partially take care of their typical job. We sometimes see young people delivering food to elderly neighbors who are more vulnerable. We see people wearing masks, not to protect themselves, but to protect others. We see nurses volunteering to move to hotspots of the pandemic in order to help, even though they know that their health and in fact their lives may be at risk. So individuals, again, masked, and in fact they do take responsibility for egotistical reasons. There's a little bit of Adam Smith's invisible hand at work, but also because they're moral beings and because they're obliged by law to do so. The second point is that the state has to take responsibility, especially in a time of pandemic, because the state is responsible to take care of goods that we call public goods, goods that cannot be provided by the market because people are tempted to take free rider positions. So let others take precautions and public health will be secured. I will take all the liberties I want. So the government has to enforce rules. It also has to enforce rules against armed thugs who storm state capitals or who force the opening of businesses where public health authorities think it is not safe to do so. And governments, in addition to providing public goods, also have to secure the safety and health of those who cannot take protective steps because they're at the lower end of the social stratification system. They are vulnerable. And I think of elderly, and our system has failed the elderly, especially those in homes and nursing homes, terribly. The government needs to make sure that rules be established and enforced to better protect those old people. In Minnesota, for example, I think out of the 700 deaths, roughly so far, 600 have occurred in homes for the elderly. The government has an obligation to take care of people in detention, especially children and juveniles, so that their short-term jail term or prison term will not turn into a death penalty. A government has to take care of low-income people. People live in tight quarters where they cannot practice social distancing. People work under extremely unhealthy conditions, and we learn terrible stories about the meatpacking industry, conditions we didn't know before this pandemic, with massive outbreaks of the virus. And we see this not just in the United States, but also in Europe. And in both cases, it is primarily immigrant workers who are affected. So government needs to take short-term action, as Congress has partially done, and the administration needs to pour out that money more effectively, but also longer-term solutions by securing access to health insurance, irrespective of employment status, and by securing minimum income as people fall from one month to the next into hunger and depend on food banks. So it's a pandemic. Again, it's like an enlargement glass that allows us to see that if some fall, others are at risk to fall behind them, to be pulled after them. Government has an obligation to prevent that from happening. So I come to my third point, that the state needs to be kept in check. It was Thomas Hobbes who had the fantastic idea of the Leviathan, to whom we delegate our rights, so that Leviathan keeps us from being man's wolf. And Leviathan has had some benefits. The reduction in civil society violence, homicide rates in Europe from between 30 and 40 per 100,000 reduced to 1 per 100,000 today over the past 3 or 4 centuries. But Leviathan, when he is not being checked, also has enormously destructive force. And especially during times of emergency, state of exception, emergency powers. Hungary has passed an enabling law allowing the government to govern by the executive to govern by decree. A terrible echo of 1933 in Germany. And those who suffer most when government overreaches are exactly, again, the weaker members of society, immigrants, refugee seekers. The Center for the Victims of Torture had a fascinating webinar just a couple of days ago about the conditions at the southern border of the United States. We know about Nazi medicine, where for the good of the folk, individual dignity was sacrificed in eugenics programs that were embraced by the medical profession at the beginning of the 20th century in Germany, not alone in Germany, but also in the United States. So we need to learn this balance between public good and private individual dignity. And then individuals, and this is an important point, don't just act as individuals, they act as civil society, and as civil society, where they are bound together as moral and social actors, for example, in social movements, in NGOs like CVT or Advocates for Human Rights. They have the ability and obligation to keep government in check, especially in times of crisis. So concluding from the 3 statements, individuals do and have responsibilities, they fulfill them. Government has responsibilities, the government needs to be kept in check. I think we face a number of difficult balancing acts between different types of rights, but also between different actors, civil society, government, and individuals. Balancing individual rights and responsibilities, balancing state intervention and state restraint. And maybe we discover in this pandemic also a weakness of institutions in American society today, in politics and in media, that favor grand ideological proclamations over these difficult balancing acts that in fact we face. And I will leave it with that for now. Thank you so much.
Thank you, Joachim. I'm going to move on to Dr. Mishori. And Ranit, you've had live experience working in the southern border and other immigrant communities. What steps can we take, either individually and collectively, to figure out ways as medical and scientific experts to shape the human rights responses to the pandemic? And in particularly where there is tension between elected officials and public health officials, are there ways to resolve those conflicts?
Thank you, Shaili. And this is such an honor to be invited and to be sharing a screen with Joachim and Catherine. Thank you so much. So I think, going back to the issue of the responsibility of all actors, I'm going to speak for the actors that I know best, which are physicians and health professionals and other public health experts and some scientists. I think other people have covered the idea that this public health emergency is also a human rights crisis. And some of the other examples are states using excessive force to enforce quarantine and lockdowns. We have the crisis is used as a pretext to adopt repressive measures like restricting freedom of movement, freedom of expression. We're seeing a surge of attacks on healthcare workers around the world and in the US. And we are seeing some alarming trends of states using technology like for surveillance to contain the pandemic and to trace cases. But I think, as you have already alluded to it, more importantly, what this pandemic has exposed is the deep inequities in our society here in the United States and globally. and we've seen that the pandemic has exacerbated the vulnerability of the most, or the least protected in society, which include women and children and the elderly and people of color and migrants and refugees, the poor and the homeless, and the list is very, very long. All of these groups being impacted very, very profoundly. These inequities in the medical education field and public health and in other fields is what we call the social determinants of health. So factors such as education and housing and access to care and poverty and their very direct impact on the health of individuals and populations. And as health professionals, not just doctors, but nurses and others, we see these up close every single day in hospitals and in clinics, refugee camps and community-based facilities and prisons and in nursing homes. And often what I tell my students and my residents is when you look at the social determinants of health diagram, and I don't know if you remember it or you can picture it, but what you're not seeing in that diagram is what influences their creation, the creation of the social determinants themselves. And oftentimes those are linked very, very directly with human rights principles or the absence of them, or human rights abuses. For example, if you think about the right to education and how that directly affects one's ability to attain education, which is then becoming a social determinant of health, the right to water, the right to health, standard of living, all of these are almost word to word what we're talking about when we talk about the social determinants of health. But many healthcare professionals don't know much about human rights. They don't even know that they're talking about human rights principles when they think about the social determinants of health and how closely they're related to the study and practice of medicine and public health, and how human rights are essential qualities of health and how their abuse has profound health consequences. So I always try with my students and with my residents to highlight the similarities between human rights and the social determinants when I teach, and between human rights and medicine itself. So the intrinsic value of alleviating human suffering, the idea of the overall promotion of health and well-being, the inherent worth and dignity of individuals as a core value both of human rights and of medicine. And in medicine and public health and science, there is so much room to teach human rights, and there's an actual need to teach human rights, but it's not really done that frequently enough. And so, first of all, I think the key to the responsibility of public health experts and physicians and health workers is the knowledge, is to educate themselves and to be educated about human rights issues. So knowledge comes first about human rights and the interconnectedness of rights in and of themselves, but also their interconnectedness with the idea of the social determinants of health, which is now taught in every single medical school and is talked about during first to fourth years, and in all residency programs that I know of, we are talking about the social determinants. But people fail to connect that to human rights and to these responsibilities. So once a physician or health worker is aware of these issues, and you start seeing this in practice, and that you recognize that there are many practical implications. So at the individual levels, for example, we see people who have been affected by the social determinants of health or human rights violations, and we can act in a very, very concrete and practical way in a clinic, for example, to address some of these issues. So some practical implications include conducting asylum evaluations, or working with victims of torture, or with victims of female genital mutilation, or collecting evidence about human rights abuses, documenting them both here in the US and abroad. And the thing is, the more you do it, the more you see the trends. And once you see trends, there's this moral and professional duty to speak up. If you see one case, it maybe is one case, but when you see a case again and again and again and again, there is the moral duty of being a physician or healthcare workers becomes more important to do something about it. So to assure that there's equity in prevention and in treatment, to take part in special plans and actions to mitigate risk for vulnerable populations. So, for example, this could be related to COVID, but it's also very broad and predates COVID. But then what happens then is that in order to promote equity, essentially what happens to a healthcare professional, and I've seen that in many people, including myself, is that you must become an advocate. And that's not something that health professionals or scientists are necessarily trained to do. But I'm seeing this shift in medical education. More and more students are interested in advocacy and justice, social justice, and there are more and more courses and opportunities to meet this demand to learn about advocacy and to participate in actions that exist across medical education, public health education, a little bit more, but in recent years, in medical education. So people are teaching and learning how to write op-eds, how to write letters to the editor, how to organize vigils. There's so many activities to choose from. There's no one size fits all. But what we have as physicians, as health professionals, is we are there to bring the stories. We can tell the stories of individuals that we see in our practice to help illustrate some global trends. Of course, stories are incredibly important and they help convey some of these issues, but it's also always important to include and even lead with the science and with the evidence, because this is what separates us from other activists, is this education and the science orientation that we have as a profession. Another level of advocacy it calls for collaborating with public officials through perhaps some professional organizations. So there is that duty of professional organizations to also take on these issues, to message to the community and to elected officials together. So for example, at Physicians for Human Rights recently, we had a campaign on the provision of PPE to health workers. So we worked with a whole slew of healthcare organizations to demand not only that PPE be available to implement safety measures, but also to end the retaliation and protect the physicians and nurses who spoke out about it and were retaliated against. Partnerships are incredibly critical, so going from the individual to the collaborative to partnerships that also bolster the credibility of people from different walks of life. So for example, I'm thinking of medical legal partnerships. Again, during this pandemic, many of us have recently participated in emergency litigation to release high-risk individuals from prisons and jails and immigration detention centers. So this is a very practical way to use the science and background and the medical education skills that people have to work in interprofessional ways with lawyers, for example, to help vulnerable populations and people who are suffering from human rights abuses. The partnerships are also important with elected officials. If you have elected officials who actually agree with you, both at the local level or national or international level, and to maybe jointly craft policies that take into consideration human rights and the social determinants from the very get-go. I think we are teaching and seeing more and more health professionals take that individual responsibility and put themselves out there, telling stories, ensuring that messages are delivered in a caring, knowledgeable, clear, and scientifically sound manner. I always tell people, if you see something, describe what you see, explain the root causes, suggest solutions, demand transparency, demand accountability, and in the end, you need to demand justice if this is what you see in your day-to-day life. So what we've seen with this pandemic is also how political powers have used COVID as an excuse to advance their political agendas. And this is kind of where the government shaming comes into play. The government, of course, the crisis is being used as a tool for xenophobic policies, as a pretext for neglect of refugees and IDPs, for the expulsion of asylum seekers and unaccompanied minors. But I like to speak about the importance of human rights to health and the role of the social determinants, but really at the end of the day, I personally, and I hope others too, have come to recognize that it's really all about politics, and it's more about the political determinants of health than the social determinants of health. And because it's the political decisions to put people in cages or in immigration detention. It's a political decision to provide or deny health insurance. It's a political decision to ship or produce PPE to hospitals, to enact rules about hazard pay to frontline workers, to come up with laws about sick leave, to accurately record and report death rates from specific populations related to COVID-19, to fix the pipelines in Flint, Michigan, to deny or allow coverage of reproductive health care, and to ratify UN conventions. These are all political decisions. So while maybe this is a radical view, but many people think that the doctors and scientists should sort of stay in their lane and focus on the biology and the pathophysiology and the science, and really not get involved in politics, not even opine about politics. But science and medicine and population health have always been influenced and even shaped by political decisions at the local level, at the state level, and the federal level, and the Supreme Court even. So these political determinants of health will really affect us and our patients for decades to come. And this, I think, demands action from us as doctors and as scientists and public health experts. So just like advocacy in general, there are so many flavors, from speaking out and shaming governments to blowing the whistle and holding governments accountable through legal mechanisms, to assuming leadership positions in government, to organizing, to working on political campaigns, to voting and convincing others to vote, and even for scientists and physicians and health workers running for office, which I think is incredibly important. More scientists and doctors are doing it, and more should do it. And finally, I wanted to say that even the American Medical Association has a declaration of professional responsibility that states that humanity is our patient. And it asks physicians to use their skills, quote, beyond the bounds of the traditional patient-physician relationship in responding to exceptional global conditions and need for care. This was written a few decades ago. I don't know another situation where the exceptional global condition is the one in the present time with this pandemic. So I wanted to end with a tweet that I just saw the other day by someone named Dr. Amanda Calhoun. I don't know her. She's a psychiatry resident at Yale, and she said, as long as racism is rampant in the medical system and in our country, I will continue to take a stand. If we call ourselves doctors, we should also call ourselves activists. So again, going back to the individual responsibility, that is my manifesto, and I stand by it.
Thank you, Ranit. That was wonderful. Just a quick follow-up. This is based on your article that just came out in The Lancet about physicians being subjected to violence while they're doing their duties around the world. Any quick comments about, the responsibilities of individuals while they're interacting with the healthcare system?
Yeah, so what we've seen is, and we've heard reports about physicians and nurses and other health care workers around the world being targeted because they're physicians and healthcare workers in the context of COVID-19. I mean, this is an issue that's been going on for many decades, and is in the context very badly happening in the context of conflict. But in the context of COVID-19, there is a perception that physicians are in and of themselves, in some countries, people see them as the vector of the disease, and as such, they've been targeted in horrible ways. So I think the article that just came out from us at PHR and the International Council of Nurses and the World Medical Association today in The Lancet, fresh off the press, talks about these issues, and then the accountability and whose responsibility it is. And again, partly it's personal responsibilities of the public, to educating the public to not use violence in any way, but certainly not against health workers in the middle of a pandemic, but also the accountability and responsibility of governments to help enforce these issues and to help protect healthcare workers. Because if they're not protecting healthcare workers are not going to be able to go to work and protect the population.
Thank you. Thank you, Ranit. I'm going to jump to our questions. There is a really wonderful set of questions that have come through. Patrick asked a question, what might enforcement mechanisms for responsibilities look like? And Catherine, would there be a framing and enforcing of responsibilities in the same sense as you talked about? And a follow-up to that is, are there ways to figure out responsibility treaties in the future? How might they work? And how might we prevent them from being abused by states as a cover for suppressing rights?
Great questions. So first, in terms of enforcement mechanisms, I mean, Joachim made the point is that the responsibilities and duties are called for under national law, and they're in national constitutions. And in fact, one of the reasons the American Declaration of Rights and Duties of Man had so many responsibilities was because Latin American constitutions had attention to rights and to duties. The Mexican Constitution of 1917 had, and I love it because we just talked about this, had a duty to educate oneself. That's what Ronnie was just talking about. You have a duty to educate yourself, and you have a duty to educate your children, and of course you have a right to education. And they saw those three as going together, not only talking about your right, but talking about rights and responsibilities. So, so you could have enforcement through domestic law where it exists, right? The kind that Joachim talked about. But under international law, there are international law with the international human rights law, okay? Only with international criminal law do we have individual responsibilities that can be enforced through courts. And so the International Criminal Court, of course, is an individual criminal accountability court holding individual leaders as well as members of insurgent groups and others criminally accountable for mass atrocity. But aside from that, human rights law has not had provisions for accountability for individual or group responsibility. There is a move now, we know, for more corporate responsibility for human rights, but that has gone a soft law route through the United Nations, through the Social Compact, and through the guiding principles for business and human rights. So far, there's move underway to try to write a treaty, but on corporate responsibilities for human rights, but that treaty is not prospering right now. So my feeling is, you know, and this is not the first time people have wanted to write a responsibility treaty. There have been many, I think my book, I talk about 8 or 9 different attempts for responsibility treaties, all of which, responsibility declarations that would like to be treaties, all of which failed, okay? So, and I think they fail for exactly the reason some of the panelists have mentioned, and that is that the fear that governments will use this as a way to deny people their rights, right? And so I think we have to go the route of enforcement very carefully. And personally, that's why I framed it in ethical and political terms more than in legal terms. Now, of course, we have professional responsibilities too. I should mention that, but professional organizations like physicians, but many other professional, including political scientists and sociologists, have ethical professional guidelines that might involve some of these issues. So, but overall, I'd say a big part of this is still going to be this issue of discretionary. And I like what Ronnie said. She talked about there's not a one-size-fits-all model for responsibility. Because there's not a one-size-fits-all, it's going to be hard to, you know, write a treaty. And I personally don't think we should go that direction.
Mm-hmm.
Any follow-up comments, Joachim? Or
well, I would like, you know, Catherine, what you wrote in your book is so timely, and you said you didn't know there would be a pandemic when you wrote it, but we have triple reasons now to read your book and to buy it, maybe too. But I want to thank Renit also very much for your comments, and they resonate so much with me. Number one, something we haven't really very much addressed, but it popped up in your words, is that this is also an international crisis. We talk about inequalities within nation states. We have to talk about inequalities across nation states, and we know that poorer nations will be especially hard hit. They don't have the same medical facilities that we have in Europe or in the United States. So support for the WHO, whatever reforms it might need, is particularly crucial in the current era. And I'm also, Ranit's point also made me think of old debates that gave birth to Doctors Without Borders, MSF, because MSF said at some point we cannot go along with the International Red Cross anymore and stay neutral and not articulate political positions. We have to point our fingers at those mechanisms and individuals who caused the suffering that we try to alleviate as physicians. This came out of the Biafra War, as is very well known. And then a point that, again, Catherine made, but also Ranit, is that we are responsible either as healthcare providers or as scholars. And I'm very pleased that the University of Minnesota, for example, has prompted quite a number of courses that speak to in the liberal arts, in medicine, in policy, that speak to the current crisis. And let me also mention in this context something that we did before we knew there would be a pandemic, is when we created the Minnesota model, building interdisciplinary capacity to defend human rights in challenging times. So this is a multidisciplinary initiative, and Fionnuala Ní Fhlathartaigh, Bob Fry, Jessica Stanton, myself, and many other colleagues were involved. And we tried to bring together faculty, students, and practitioners to identify critical challenges to human rights. And this is more important in the current era than it has ever been. And then to propose innovative, timely solutions, especially in a time of global pushback to human rights. There is a grand idea that Donald Stokes once made, and he called it Pasteur's Quadrant. It's a book with that title, when he says there is interest in basic research and not interest in basic research. There's interest in applied research and not applied research. And there is one quadrant here where interest in applied and basic research meet, and that's Pasteur's quadrant, named after Louis Pasteur, who embodied that spirit. And that's exactly what we tried to do. And we were able to fund about 20 projects in sociology, political science, law, with practitioners such as the City of Minneapolis, the CVT, the Nonviolence Peace Force, the Canadian Museum for Human Rights, Tierra Digna, NGO in Colombia, Amnesty, and many other organizations. So this is an attempt as scholars to connect scholarship with practical efforts, and we should think about ways of applying this in the current pandemic in a way that advances basic science, that provides us with scholarly insight, but that at the same time serves to improve the world. Sorry about the very banal and often used words.
Thank you for that. We have a series of questions, and this is also a nod to your political determinants of health, Ranit. But this is to all the panelists about how do we avoid violations imposed by majorities against others? A follow-up on that is with the current priorities, political priorities, many of the minorities may not feel comfortable asking the government for support or help or safety for that matter. How do we then keep the government in check, in particularly vis-a-vis the minorities? And on a similar vein, what does this mean in terms of the indigenous sovereignty of tribal nations within the US too?
I'm not sure if this is addressed to me, but I can say that, you know, this is during this pandemic and the fact that we're all at home, there are travel restrictions, I think it's making the monitoring of human rights violations affecting small communities, remote communities, much, much, much worse. It is impossible to send people across to, I don't know, to Bangladesh or to Burma or to Iraq or to Syria to monitor and see it with your own eyes. So I think the idea of relying on local partners, local actors, local civil society organizations, and this partnership, and I like what Joachim said, that has to be interdisciplinary. There's no question that doctors alone can't do it, human rights scholars alone can't do it, historians alone can't do it. It has to be an interdisciplinary effort, and we need to work with local populations and rely on them, because right now that's the only way for us to get any information about what's going on and how this pandemic is affecting them, because we can't travel, we can't go into prisons, we can't go into, all of these monitoring mechanisms are basically null and void at the moment. And then it's about holding governments accountable by making them, by shaming them in a way. And this is the role of human rights organizations and people who are seeing this, who are physicians and others, shaming and naming and holding people accountable through legal mechanisms, but also through the media. I mean, there's nothing more damaging to a government, I think, than having bad PR. Again, it doesn't affect. There are a lot of despots and authoritarians it doesn't affect them. But this is the role that I see of people like us in public health, in medicine, is to hold the evidence to their faces and shame and name.
Thank you, Catherine or Joaquin. Any added comments to that?
Well. Human rights, of course, were they were developed in part to protect minorities from majorities, right? And sometimes we forget that, but we forget the majorities have, many times in the past, been willing and able and even eager to use their majority power to violate the rights of minorities. Having said that, I want to also say that sometimes the question is where is the majority here, right? And with regard to our own government, I want to point out that the majority were the people who didn't vote. Okay, 40% of the US population did not vote in the last election, and that's more than voted for either candidate. Okay, so what we have here is a majority that is partly suppressed. Okay, but I promise you that if that 40% didn't vote, the bulk of that is not suppression. The bulk of that is some other combination, including a typically US, I think, kind of libertarian notion. And this is where rights are not enough, okay? And that is that I have a right to vote and I have a right not to vote. Enough said, okay? Instead of saying, no, you have a right to vote and you have a responsibility to vote. And in fact, you do not have a right not to vote. You have a choice not to vote for which you will not be sanctioned. But we're not going to dignify that choice with the term right, okay? And so it's a crucial issue that we also think about a responsibility to vote. And that's responsibility not just of individual responsibility, of course, of state municipal government, of course, of the federal government, which is completely out to lunch on this one. And so state and municipal groups have to step up, but everyone in the United States has to step up to help people exercise responsibility to vote. And I mean, universities have to do that. And we're now seeing for the first time, universities are finally engaging to help, they're engaging in a nonpartisan way. Okay, because it's not about telling students who to vote for, it's telling students how to vote. And I did, if I can just have a brief thing, I did a focus groups with Harvard College students. And you'd think if any group of students should know how to vote, Harvard College students. And what I discovered is they find voting very confusing. They're not sure they have responsibility to vote. Some of them think they have a right not to vote, and they really need assistance from their universities and from their professors about the mechanics of voting, as well as about the ethics of voting and responsibility for voting.
Well, I so much appreciate this point about voting. Goodness, it drives us mad when we see the rights that come with responsibility in this realm that people do not live up to. Catherine, I embrace that. We have to be aware, of course, that we are political animals, we are legal actors. There is the possibility of political organization, maybe the importance of unions, labor unions becomes more visible again. And I think, and I mentioned the meatpacking industry, one more time, but also other sectors. We know about the high death rate, well, in the medical profession, but also among bus drivers, for example. And we are legal actors. There is something called class action lawsuits, and I could imagine pro bono lawyers stepping in and helping communities that are terribly hurt by the current crisis or any similar crisis to file a class action suit against corporations that run nursing homes, for example, for profit, or prisons for profit, to the detriment of those who are herded together in those institutions. And then finally, I recently talked to a school administrator who said they ordered many devices so students who are underprivileged and don't have access to internet in their homes and thus cannot participate in school activities that are online. Maybe we have to make a concerted effort to build up on remote communication technologies within and with disadvantaged populations, including, for example, tribal groups, so that we can monitor human rights violations better than we currently can. I know there are NGOs that have distributed video recording capacities in places where human rights are at risk in order to communicate those recordings to organizations that can step in and take legal or political action. And maybe we need more of that in the current time. We see so much abuse of online communication. Maybe there's urgency to put online communication to productive use for the protection of human rights in this situation.
Thank you. Thank you very much for that. I know we don't have much time, but a quick comment here. There have been multiple questions that have been addressed primarily to Ranit, but I think all three panelists, if we can do a quick check on this, about healthcare as a human, as a basic right. There's a whole comment about healthcare industry being such a for-profit industry in the US and how that is not the way to go, and the public health emergencies that we're facing right now is exposing that. So any quick comments on that?
I mean, all I can say is that I hope that this crisis is really exposing the ridiculousness of this fragmented healthcare system. We're looking at millions more people who have lost their job and will not have health insurance. I mean, how is that even possible in a humane society? I mean, it baffles the mind. So if anything good comes of this pandemic, I hope that people will realize that healthcare is a right, that health insurance and health coverage needs to go to everybody, regardless of their having a job or not having a job. And if that happens, that's enough for me. I'm not saying that it's worth the untold grief and death, but it maybe has done something in exposing how unbelievable the situation is.
Catherine, any comments on that?
Bravo for what Ranit said.
Joachim?
Yeah, well, I agree. I'm skeptical. I know that crises like this, that it's stoke fear, that stoke mistrust in vulnerable populations, in minorities, can result in terrible outcomes. I'm very concerned, and we have to be very alert to that. And Ranit gratefully portrayed a more optimistic scenario, and I very much hope that as scholars, as individuals, as citizens, we can contribute to guarding against the terrible outcomes, traces of which we already see in attacks on minorities, growing anti-Semitism against Asian Americans, that we can guard against those threats and make the hopes that Ranit formulated so beautifully come true. Yes, we need a more solid public health and system in which each individual's health is secured, because if it is not, then that of others is at risk as well.
Thank you. Thank you very much for that. There were multiple other questions, but in the interest of time, we're not going to go there. Catherine, you asked me the question about the Center for Global Health and Social Responsibility, and this is not a shameless plug. It is just a question about where global health is. I inherited the center from a predecessor. The first person who used the term was Phil Peterson, who founded the center here at the University of Minnesota. And the premise has been that global health has been an extractive industry, if you will. There's been a lot of research done elsewhere for benefits here, or it's been a top-down approach, as in, oh, those poor people have nothing, so we need to export our models. Our center's goal is to try and find ways where we partner and learn from and with each other. So that's the ethos in which we are hoping to have more of the global health activities. And with that, folks, I really appreciate every one of you. This has been fantastic. I appreciate the audience. This has been great discussion. And I'm sorry I couldn't get to all the questions, but please tune in. Thank you.
Thank you very much.
Thank you.
Thank you very
Thank you.
much. Such an honor. Thanks a lot.
Appreciate it equally. Yes.